This short presentation is to acquaint you to the NACNS Clinical Nurse Specialist Credentialing and Privileging Toolkit. The purpose of this toolkit is to assist CNSs in understanding the credentialing and privileging process. Taylor, what is credentialing and privileging?
Credentialing and privileging is the process of authorizing a licensed or certified healthcare provider their specific scope of patient care services. Credentialing is the process of verification by which a candidate's professional education, experience, and training are reviewed and substantiated. Privileging gives a provider permission to perform specific activities in a hospital or healthcare facility.
Manissa, what are some reasons why a CNS should consider credentialing and privileging?
It is a part of full practice authority. This will vary by your state law and regulations. It increases timely access to patient needs. It validates a CNS as an APRN capable of providing care, treatment, and/or services in line with other APRN roles. It increases the value of the CNS. It provides the ability to formally consult and refer to other interdisciplinary clinicians without a physician co-signature. This will also vary by your state law and regulations. It increases the organizational value of the CNS by providing a mechanism for third-party billing of services provided by a CNS, thus generating revenue for the work they perform.
Melissa and Jean, how does credentialing and privileging allow the CNS to practice at the top of their license?
This allows for CNSs to bill for services. Many times, there are services that non-credentialed CNSs are performing in their current role, which are billable. Examples of billable services include, but are not limited to, consults and follow-ups, evaluation and management services, advanced care planning discussions, complex care coordination, patient education and group visits, and procedures that may include, but are not limited to, such as ABG interpretation, ECG interpretation, feeding tube insertion, skin punch biopsies, wound care, and pelvic examinations.
CNSs that are credentialed and privileged may also provide prescribing. Some things that they may prescribe are diagnostic studies, pharmacologic therapies, non-pharmacologic treatment and interventions, medical equipment and devices, procedures. They may discontinue therapies and treatments, and they may write orders for home care.
Alyssa, what are some steps for credentialing and privileging?
Some of the steps in credentialing and privileging are to understand your state statutes and regulations and what the scope of CNS practice is. Understanding your organization, employer's position on CNSs. Doing an organizational assessment, see where the CNS falls on the organizational chart. Look at the Medical Health Professional Executive Committee bylaws and who the key stakeholders are. Obtaining credentials and privileges is really important. Get your NPI number. You can find this in the toolkit about all the steps to go to get privileges and credentials, and maintain those credentials and privileges. Know the process for doing that. Participate in ongoing professional practice evaluation.
You can view and download the entire Clinical Nurse Specialist Credentialing and Privileging Toolkit located on the NACNS website under the Resources tab.